Hello, I'm Hartmut Goldschmidt from the University Clinic Heidelberg here in Germany. On behalf of my co-authors, I'm happy to present our poster summarizing methods and findings of our adjusted comparison and outcome in patients treated with cilta-cel in the CARTITUDE-1 study. And we compare these patients with multiple myeloma patients with similar baseline characteristics who were treated with therapy used in real-world clinical practice identified in Germany by the registry from OIS. Despite recent advances in care, multiple myeloma remains mostly incurable in patients who have treated with proteasome inhibitors, immunomodulatory drugs, and an anti-CD38 monoclonal antibody. These patients have few treatment options and poor outcome. In the CARTITUDE-1 study, we investigating the efficacy and safety of cilta-cel in these types of triple-class exposed patients. This study has not a comparator arm. So we compared outcomes from CARTITUDE-1 to outcomes in patients receiving treatment using in real-world clinical practice in Germany. Real-world clinical practice patients were selected from the registry here in Germany, and they have the same key eligible criteria as applied in the CARTITUDE-1. The registry from OIS contains data from a representative sample of 108 German cancer centers. Outcomes compares including overall survival and time to next treatment as a proxy for progression-free survival, as the progression was not gathered in the Oncology Information Service registry. We presented 113 patients were enrolled and 97 patients were dosed with cilta-cel in the CARTITUDE-1 study. These correspond with the intention to treat and modified intent to treat populations. From 4,062 patients in the Oncology Information Service registry, 312 observations from 220 patients were analyzed for intention to treat comparisons, and 223 observations from 174 patients were analyzed for modified intent to treat. As shown in the right side of the poster, the patients were similar in the cilta-cel in the real-world clinical practice group. We have shown that the patients have a better progression-free survival and overall survival were treated with cilta-cel. The hazard ratio were 0.25 for overall survival and 0.70 for time to next treatment. In conclusion, our analysis found that patients treated with more than 3 therapies had an overall survival of only 12 months. Due to the treatment with cilta-cel, the overall survival could be strongly improved. By using different approaches to compare patient treatment groups, we demonstrate that cilta-cel reduced the risk of death by up to 86% as compared to real-world clinical practice. This treatment reduced time to next treatment by up to 87%. We acknowledge that our analysis cannot completely exclude residual confounding factors, but we did account for a wide range of prognostic factors. Our results highlighted the cilta-cel potential as a novel and effective treatment option to address unmet needs in triple-class refractory patients with relapsed refractory multiple myeloma based on comparison with a German cohort. I want to thank you so much for your attention. Thank you.